One of the decisions that every patient is going to have to make if they elect to have a surgical hair restoration procedure is, do I want FUE, follicular unit extraction, or do I want a strip method harvest? Basically, those two methods of obtaining grafts from your head leave the donor area in a different situation. If you have a strip procedure, it leaves a linear scar in the donor area, typically about 2 millimeters in height, and the length depends on how many grafts you've obtained. The other method, follicular unit extraction, does not leave a linear scar, but it leaves multiple small round scars, usually less than a 25th of an inch in diameter. What I tell patients is, think about different factors and decide which one of the harvest methods meets your needs the best. So let's talk about some of these factors. If you have a strip procedure, the scar that is left is usually very easily covered. If your hair is at least an inch long or longer than that, it's virtually undetectable. Even if you told someone, like your stylist, that you had a scar back there, it'd be even highly unlikely that they'd be able to see it. Follicular unit extraction does leave scars, as I mentioned, small little circular scars, but they're spread out and virtually invisible. Now, that doesn't mean that you can shave your head with a big razor, because in that case, they may be visible. But this option will let you wear your hair shorter, often less than an inch. I have some patients that are able to wear it 1/8 of an inch without being detectable. The second process that we should discuss is when you use one of these methods for removing the grafts, is that the healing phase is different. When you have a strip surgery, there's going to be a little bit more associated pain or discomfort, typically 2 to 3 nights of mild to moderate pain. This is followed by about a week or so of soreness, and then that goes away, but you're left with a sensation of tightness and numbness that may last a month or two. That's for the strip surgery. Follicular unit extraction, by nature of how we perform it, is less invasive. We remove about 40% less skin for the equivalent number of grafts than we would with a strip procedure. The other thing is that the trauma is spread out over the entire donor area, not concentrated in one position. What this means is that it heals much quicker. Usually, the patient will experience 2 to 3 days of mild to moderate soreness, so not even up in the pain scales. And then after about 2 to 3 days, the donor area feels almost entirely normal. Finally, because of the invasive nature or more invasive nature of the strip surgery, we ask that you avoid heavier strenuous activity for about a week. Whereas if you have the follicular unit extraction technique, after about 3 days, you can get back to heavier strenuous activity. Now, if you're an Olympic athlete, that could be very important, but if you're the average person, that may not make any difference at all. If you've decided to have surgical hair restoration and have decided on the follicular unit extraction or FUE technique, in my office, I offer 2 methods to perform this procedure. One of them is the SAFE system, or surgically advanced follicular extraction, and the second is the ARTIS robotic system. I have extensive experience in both and developed the SAFE system approximately 13 years ago, and I was intimately involved in the development of the ARTIS robot. I was the first clinic in the United States or in the world to have the ARTIS system. I can tell you that the results are essentially the same with either method, but the reasons you might choose one or the other are different. What I tell my patients is that if you have no preference one way or the other, that I would go with the ARTIS robotic FUE. And the reason for that is the development of the ARTIS system resulted in the ability to remove grafts from the scalp that have a little bit more fat around them. And that fat, I believe, confers some protective capabilities. In other words, the fat protects against handling effects, and it also protects against drying. I think that may give a little advantage of survival to those grafts. The downside of having the ARTIS robotic system surgery is that we do have to shave your donor area completely, and by that I mean down to a length of about a 25th of an inch. The ARTIS robot needs that length to assess angles and directions and accurately perform the FUE. That works fine for most patients. However, there's a population of patients that in fact do not want to shave their head for a variety of reasons. They may not want to for work reasons or social events, but there's also a population of patients that have had previous strip surgery, and by shaving the donor area, it exposes the strip scars. That group of patients may not be thrilled about shaving their head. I do offer another option, and that is FUE with the SAFE system. With this technique, we offer something called IFT, individual follicular trim. And with this method, we actually go in and cut the individual hairs that we'll remove with the SAFE system and leave the rest of the hairs long. In essence, what this means is that you can have an FUE procedure and not have any visibility in your donor area that you've had the procedure performed. Again, the results in the area where we do the transplant is essentially the same. So when considering your options for follicular unit extraction in my office, you just have to decide whether or not shaving your donor area is right for you.